everybody. I am Debbie Beth from the, I'm sorry, not Rockland County Clerk. I'm so used to saying that, that's my other job. From Woodbury Ambulance. I'd like to welcome you here today. We're really excited about doing this, something I really enjoy doing. We did this once before in the ambulance building. We had about half the people, so we were wonderfully happy to welcome other people here. And we have people also from far away. I think we have a group from Warwick. Where are they? Okay. We have the Woodbury Animal Shelter, where there's Woodbury. And then we have a lot of pet owners here who love their puppies. What we are going to do this morning is, this afternoon rather, is the vets will give a presentation on pet CPR. Then a few people from the ambulance will go into human CPR. And this is going to be a very quick demo. This is in no way a certification. It's strictly to give you a little view of what to do if you, as a layperson, come upon someone who is down on the ground and out. Often people get very scared. They don't know what to do. An operator will say, start CPR. They don't know what to do. We're going to give you a little bit of a feel for it. We'll have you come up later after. You can even practice on our mannequin. And this way, if somebody does go down, I'm not saying you're going to do the whole CPR routine, but you'll be able at least to do some chest compressions and keep things going until the ambulance or a medical professional does get there. In addition, we are going to show you a very exciting machine that Woodbury Ambulance has. We actually have 4 of them. They are called the Lucas machine, and it's a machine that is put on top of the chest, and it does the compressions for us. And you'll be very interested to see how it does that. So we'll be doing that, and then we will move back to the vets who will do some first aid, and we will wrap it up at the end with the police officers, the canine unit, and they have 2 of their canines here, and we're going to all move outside. This is going to be the end. We're going to move outside, and they're going to give you some demos on what they do. And they're from the Woodbury Police Department. So we're very excited. I just would like to start by introducing some of the people that we have here. First, from the village office, we have Village Trustee Matt Fabro. Matt? Fabro, sorry. From the town, we have Teresa Luongo, who is a town councilwoman. Right here. Just want to introduce them quickly now. From the Woodbury Police Department, we have Kevin Ambrose, Canine Officer, and Ryan Sinclair, Canine Officer. From Woodbury Ambulance, we have Mr. Scott Sommer, who's been with the ambulance for how long, Scott? 38 years with the ambulance. Jonathan Swiller, Beverly Silvera, and Rachel Bruce. Okay. Then, and you'll meet them in a minute, from the Pets I Love. I guess people are familiar with that business. I am, because I'm kind of partial to them. That's where I bring my dogs and have for the last 10 years. They're wonderful. This is Dr. Deborah Spitchek, and she is the vet from the Pets I Love. And Dr. Spitchek has brought with her Lauren, a licensed veterinary technician, and another assistant in the office, Jada Smat. And then finally, they have brought Ollie right here. Let's hear it for Ollie. You're going to hear a little bit about Ollie from someone else in a minute, but I'm just going to tell you that Ollie is up for adoption. Anybody that would get Ollie would be very, very lucky. I was trying to talk the canine officers into it. They said no, but anyway, I'm thinking about it, but well, whatever. So just think about that. He would make a wonderful addition to your home. Finally, with us is the person that put this together with me. This event is coordinated by Woodbury Ambulance with the Village of Woodbury and our wonderful mayor, Andrew Giacomazza. And he would like to just say a few words.
So locked away in the mayor's office is Mayor Tony Gabagool. Tony, I was wanting to bring out, but I think it's probably best if I just leave him back there for now, because you'll all be leaving here with some of his hair. Any hair you find around the room, by all means, take it home with you, because it's his, and I don't need to clean it up. I want to thank Woodbury Community Ambulance. This is their event. We're just giving them a spot for it. Not only do they save lives throughout the community and answer those calls that very few do answer, but they do things like this, these type of training seminars that they provide, or blood drives, or the Narcan classes that we have hosted here. It's all in an effort to educate the public and just make us better human beings. So on behalf of the Village of Woodbury, I want to thank you, but I especially want to thank Woodbury Community Ambulance. And if you ever wanted to volunteer for something in the Village of Woodbury or in Woodbury, Woodbury Community Ambulance is always looking for more people. Okay, it is a very rewarding thing you could do in this community. So I want to thank you for coming, and let's get on with the show.
Yes, and just very quickly, what the mayor said is true. We are in desperate need for volunteers. I've been the president of Woodbury Ambulance for about 5-6 years, and just actually stepped down. Somebody else took over, but this is actually my last event that I'm doing. It's been a pleasure working with them, but we need volunteers desperately. We desperately need you. Even if you don't think you could, you obviously, because you're here, you have some interest in medical and CPR and first aid. So if you could possibly transfer that to the ambulance and consider becoming a member, we would greatly appreciate it, and we would certainly welcome you. And also you people from Warwick, it's the same thing over there. So anyway, okay, so like I said, we are going to start with the Pets I Love, and I'm going to turn it over to Dr. Spitchek.
Do I have to use this?
No.
Okay. Can everybody hear me if I just talk really loud? Yes. Okay. All right. Good. So I'm gonna start. Well, first, it's really amazing to have this turnout and to see everybody from like pet owners and shelters and professionals. So, you know, I think a lot of what you all probably already know with humans also applies to animals. And so everything that I'm going to talk about is going to go for cats and dogs when it comes to CPR. The difference is just going to be like the size of the animal. And I'll definitely talk about that. So the first thing is when to do CPR. So you've all heard about your ABCs, or your airway, breathing, circulation. So the first thing that you want to do is you want to, make sure that before you start doing CPR, that the pet actually needs CPR. So a few things that you could do is you can feel, see if there's any air coming through the nose. You can put a mirror there if you have something, your phone, you have something there. Also, watch the chest, see if the chest is rising. If you're not seeing any of that, see if the pet has something stuck in their throat, because sometimes it's not a cardiovascular event. It could to feel their pulse, and two ways that you can feel for a heartbeat are you can put your hand over their chest, and you can also feel for a femoral pulse. And the femoral pulse is going to be kind of right in the groin. So on the inside, you don't want to use your thumb. So on the inside of the leg, and when you get home, feel your cat, your dog, feel their pulse so that you know what a strong pulse feels like. And so, that's another thing that you can do. And then also, okay. Also, you want to take into consideration the pet that you're doing CPR on. So if you have a pet that may have bitten into an electrical cord, fell into a pool, by all means, if this is a otherwise healthy pet, start CPR, because your chances of getting those pets back is going to be a lot higher than if you're talking about a pet that is in heart failure or a pet that has, I hate to be morbid, but I mean, if you have an let's just say, but old pet that may have underlying conditions, the likelihood and the percentage rate of CPR can be kind of low, even in our hands at the hospital with everything that we have. And so, also be a little realistic, but definitely start CPR and get them to the vet hospital or emergency hospital as quickly as you can. I think, let me see if I'm missing anything. Do you want to? Okay, so once you've determined that your pet is non-responsive, that the heart is not beating, you're going to initiate CPR. So Lauren is going to explain how to do CPR and show you guys how to do CPR.
So overall, your AEC should be around 30 seconds to a minute to determine. You don't want to spend a lot of time figuring out what's going on with your pet before you start CPR, because like Dr. Spichek said, the faster you start CPR, the greater likelihood that your pet's going to do well. So when we're doing CPR, depending on what breed you have, we'll start with, does anyone here have like a French Bulldog or an English Bulldog? Yes. Maybe, yeah, Boston Terriers too. So with any of those types of dogs, their CPR is going to be done on their back, similar to a human. But with our larger breed and small breed cats, they're going to be on their side. So this can be any of your flat-chested dogs, all of the breeds.
Would that also be any breakfast developmental? Like Japanese China, they also have flat face.
No, so not just, it's going to be more flat-chested. So they have, like, if you think of like the build of an English Bulldog or a French Bulldog, they have that wide chest and like a big flat area. Where Japanese Chin does have a wider chest, but it's not quite as big as like a French Bulldog or English Bulldog. So they would be your traditional on their side. In terms of actual CPR compressions, everyone can see you stand up if you need to. You're going to be doing about 100 to 120 compressions per minute, and you want to give a breath every 10 seconds. If you're by yourself, that's not going to be possible, because you want to keep your compressions going. Yeah, sure. Yeah. So if you're by yourself, what you're going to do is compressions for 30 seconds, and then you're going to give 2 breaths in the snout. You want to hold the mouth closed and give 2 breaths through the nostrils. And then you're going to continue your compressions again for 30 seconds. If you have someone with you, then ideally one person would be doing compressions, the other person would be giving those breaths. So in order to do compressions, similar to humans, you're going to have the dog in front of you, legs away. You're going to place your hands on top of each other, arms locked, and you're going to lean over and press down like this. Ideally, you want to compress the chest a quarter to a half, so pretty far down, and you want to feel full recoil, so you want that chest to come all the way up before you press down again. Nope. Yeah. So they're going to be there no matter what. So if you take like a dog's arm and where their elbow is, you can look on Ollie.
I mean, should it be on the left side or the right side?
No, either side is
Like
okay.
outside is okay.
Yeah.
Okay.
And if you look where his elbow hits, that's about where their heart is. So you can use that as a marker as to where to put your hands.
I'm sorry, could you repeat that? So it's 100 to 125 expressions and
Yep.
every 10 seconds?
Give a breath. Or if you're doing it by yourself, it's going to be 30 seconds of compressions, 2 breaths, and then return to 30 seconds of compressions. And then every cycle of CPR should last you 2 minutes. Once that 2 minutes is over, you want to check for a pulse or a heartbeat. If you have a pulse or a heartbeat, that means you were successful. You can stop compressions, and then I would recommend getting to your nearest emergency veterinary hospital. So it's going to be 2 minutes. So 1 round is 2 minutes. Yeah, check for your pulse, then do your next 2 minutes. Exactly. Yep. That's pretty much the basics of it. Ideally, like Dr. Spichik said before, in the best condition, like you're in a veterinary hospital, the patient is intubated, they're getting IV medications, survival rate of CPR is 6 to 8%. So knowing that as a pet owner, doing it at home, the survival rate is going to be much less. So if you have the ability to, if you have 2 people, someone's driving, the other person can do compressions while you get to your nearest vet hospital.
If the dog falls into a pool, would you first try to do anything to make sure there's no water in there before you do this?
Yeah, so that would be part of your ABCs. So checking their airway to see if there is fluid in their mouth or coming out of their mouth. You could try dangling them to see if that will get any of the fluid out. But ultimately, if their heart stopped, you're going to want to start your compressions anyway. Yeah.
So I foster pregnant moms and they live in my house. So I have 3 questions. So from week newborn to 8 weeks, how long do you do compressions for?
It would still be, you would still do that 2-minute cycle and check for a pulse. For newborns or smaller, like very small animals like that, you could use your hand for compressions as opposed to you doing like a full compressive CPR because that would probably do more damage. We don't have like a type thing. Yeah, so you can hold them. I mean, I'll use this arm as like pretend this is a small animal. And you can just use your hand and in the same exact location where their elbow hits, just compress with your hand like this in between.
Is it best from thumb or 2 fingers?
You can use your thumb or 2 fingers because your hand's going to be on the other side using 4 fingers. Any other questions? No, I'd probably do traditional, like the normal way. Sometimes with cats we'll do it that way, but more commonly you would just use both your hands and do a compression that way. Yeah?
Question, if the airway is blocked, what are you supposed to do? Because I had one last week, my dog shoot something and his air is circulating.
Uh-huh.
And it's like, what are you supposed to do? Because that hospital said, don't give him the
Correct, yeah. So if you have the ability to reach your hand in there and scoop out whatever's blocking them, you can, like, that's going to be the most ideal situation. Dr. Spichik's going to go over, like, when dogs get a ball stuck in their throat, things like that, you can't always reach in there and grab it out. So in that situation, if you don't have the ability to take it out, bring them to a vet immediately, because we would have other means of getting it out, because the Heimlich doesn't really work on dogs the same way it does on people.
So the question is, if a person is choking and you do the Heimlich maneuver, is that applicable to dogs that are choking on food or something?
So-
Or something stuck and you can't see to get it out? Is that one way to get them to throw it up? You can't get your fingers down there?
Usually the Heimlich doesn't work as well on dogs. I mean, you can try like turning them on their side and patting, like smacking hard on their chest to see if that will get them to push it out with a breath, but it's usually not as successful on dogs as it is on people or cats. Any?
Sometimes if there's, if there's something, like you said, like food, that's another thing that they choke on. And like Lauren was saying, the Heimlich maneuver is not as effective as it is in animals, but, and I am going to talk about this later. So there are some techniques that you can try. One of them is kind of just some things that you can, that you can try, and then if it's something that's stuck, right here that you can feel it, I'm gonna go over that with her.
And another thing that I have on the bottom of the CPR sheet is your normal vitals for cats and dogs. And those are important just as a pet owner to know. So if your pet's at home and you want to just sit there and see if you can get their normal vitals, looking at their gum color, looking at what their heart rate might be, their respiration rate, things like that. Those are all important to know, because if your dog is experiencing an emergency, that might not be an event where they need CPR. If their vitals are out of those ranges, you know that you can call a vet and say, like, my dog is normally, he has a heart rate of 60, and right now his heart rate is 300. That's going to be something that's alarming, and you would call a vet for. So knowing your dog's normals is really important. Yeah. They actually don't. Neonates do have different temperature ranges and heart rate ranges. I don't have them written down, but I can write them down for you later if you want.
I have something on my phone if you want to just take a picture of it.
Any other questions?
All right, so Debbie, do you want to do?
Okay, we are going to move on to adult and children. CPR. Just bear in mind that this obviously is a child, this mannequin, but we're considering and pretending as if it's an adult when we do the things that we do. And I'm going to turn it over to Scott, who's going to narrate and tell us what to do.
Everybody has seen CPR on TV. Has anybody here taken a CPR class? Excellent, very good. Have you renewed it at all? Or you just took one class and that was it? Ideally, you should try to renew it every couple of years. CPR changes. When the first time I started CPR, it's changed many times, because I've been doing this almost 50 years now. So right now, if somebody collapses, what do? First thing you do is you want to establish responsiveness. How do you do that?
Sir, are you okay? Are you okay? What's his name? John, wake up, John.
Because if they passed out, just tapping them might bring them to. The doctor said ABC, airway, breathing, circulation. In humans, they've changed the terminology now to CAB, circulation, airway, and breathing. They found out that circulation is more important than airway. So, can everybody hear me without this, or should I use the mic?
Use the mic.
Okay, no problem. Okay, is this better? Okay, good. So, the technology, not the technology, but the philosophy has changed now. Instead of doing ABC, airway, breathing, circulation, now we do circulation, airway, breathing. So they've just established responsiveness. Next they're going to do, they're going to check for quality of life. One way to do it is to check if they have a pulse. The way you check if we have a pulse is you check the carotid pulse. That's the most strongest pulse that we have. If somebody is unconscious, it's the easiest to find. The second one would be the femoral pulse. So they're going to check the pulse. They normally check it for 5 to 10 seconds. And they don't do it with the thumb, because the thumb has its own pulse. So you do it with 2 fingers. They check that they don't have a pulse.
This is no location. And just to reiterate what Scott said, we do it backwards, ABC, C is circulation. If the patient is bleeding out, no amount of compression is going to save. So you stop the bleed first, and then you continue with the compressions.
Excellent point, thank you. Okay, so she determined the patient doesn't have a pulse. So now you're going to start CPR. Now the best way to do CPR is feel the bottom of the ribs, come up to where the xiphoid process is, which is a notch over here, put 2 fingers, and put your heel on the sternum. And that's typically the lower half of the sternum. And you want to do two hands, and you want to interlock your fingers. She's going to press down 30 times. That'll be like 30 times in 25 seconds, I think. 30, something like that. And we're going to do that for 30 times. Then at the end of 30 times, then she's going to open the airway, check to see if the person's breathing, and if the person's not breathing, give 2 breaths. And then do the whole cycle again, going to 30 compressions and 2 breaths.
Doing those breaths, you check to see if the chest rises.
Mm-hmm. And you,
Not rising, then continue.
right. Yeah, as you're doing, the color should hopefully change. Your partner could be then checking the pulse to see if there's a pulse. So if you're doing CPR, you'll have minimal pulse going through because you're basically pressing down the heart and creating circulation. That's the idea of CPR. You do this for 5 cycles for 2 minutes, and then you reevaluate your patient. In the meantime, somebody calls to activate the 911 system, the emergency response system. So you call up, you dial 911, you give them the information. If you're by yourself, you put the dial 911. As soon as they answer, put the phone down and start counting. 1, 2, 3, 4, 5. The dispatchers know that if they hear somebody counting doing CPR, that they know they have a CPR call, and they'll dispatch emergency services. 95% of the time, a police department responds first. They're all trained in first aid and CPR. They all have AEDs. Anytime I've had a CPR call, our police departments have started doing the defibrillation on us before we got there. And then we've just taken over. So they're our first line of defense. They're the first chain in survival also. So now what happens is we keep continuing to do this. Now, CPR, especially at 30 and 2, is very difficult on the body. They're very hard on the individual. People have been given heart attacks doing this for long periods of time. So a couple of companies have come out. Lucas was one of them, and they've come out with an automatic CPR machine. And what that does is, while we're doing CPR, they're able to get it ready. We have a back piece on the bottom to help stabilize the back. They're gonna they're gonna do this. They're gonna work around the people doing CPR.
The book is not normally or any prop is not used. We're just using it for demo purposes. It's a child. Okay.
They're going to attach this. It just has to go a bit higher. Here we
Keep
go.
in mind, for years, both Scott and I, we've been with the ambulance for quite a while. We did CPR all the way to Garnet Hospital, sometimes for 30 minutes, over and over and over again. We were exhausted by the time we got there. Now, this is what we do.
And it does it automatically for us. And at the same time we're doing this, they're able to give ventilations to the patient. If the medic...
Thing we do as far as EMS's role at this point, this just keeps on going. We don't lift a finger. It's stopping so that we can do whatever we need to do, whether it be a pulse check, whatever. But also, the other piece that we're missing here is the AED. Before we do anything, and that's usually the police get there first, they put the AED on. Then when we get there, we put the Lucas on, and we start with the airway. We start big, so we all work together. It's, you know, we know exactly what to do. Everybody has their part. But let me go back to what I said earlier when we first started. You're not EMTs, you're not from the ambulance, you're the bystander that's walked up and somebody's on the ground. We're not expecting you to do all this. The key is to keep the heart going, because every second that the heart is not going and not beating, you're losing life. You must keep the heart going. So you may think, well, I'm just going to press a little, nothing's going to happen, I'm not going to do good. Wrong. That is the key. Forget about breathing. You don't have to do breathing. In fact, the new CPR guidelines for the layperson, some of them don't even include breathing at this point. So the important thing is, get the person, and we have this mannequin, by the way, on a table. table. That's not where it's done. The person has to be on the floor. Don't worry about hurting them, putting them on the floor. They can't be any more hurt than they are right now. Get them on the floor. Start compressions. 1, 2, 3, and do it out loud, because when other people come, this is not the time to be shy. When other people come to help, it's very important that they know where you are in the process and what you've done. Yes?
Are the number of compressions and the breathing attitude is the same for a child as it is for an adult?
Correct. It's just different for an infant. Infant would be 5 and 2. I'm sorry, 15 and 2. They keep changing it. That's why I had to think for a second. But yeah, adult and child are both 30 and 2. Okay, it used to be different. They found out it was too confusing, which was right. That was the hardest part, teaching people how to do it.
And a child, let's say 7 or 8 year old, who do the same thing.
You do, depends on the size of the child, you do one-handed CPR. Now, if you have a child that has a very big build, that looks like he's 15, you're gonna do it like an adult. You have a 15-year-old that looks like a 7-year-old child, it depends on the size of the chest and the child.
And whether or not you're using 2 hands, 1 hand, an infant, even fingers. But once again, we're talking about details, and if we start getting into details, people are going to start getting nervous. We know that. So that's why, in fact, we did this little sheet. I hope you all took it. Put it in your wallet. Believe me, when something like this happens, you're going to be like, oh my God, what do I do? You know, and literally take it out and have somebody read it to you. It's just very simple. Compressions. Just do it.
And
Keep the heart going.
point of the matter is, if you don't do anything, the person will die, definitely die. If you do something to help out, the person now has a chance.
Right.
And the more people get involved and start, then you're gonna see other people, can I help? I know CPR.
Exactly.
If you don't do anything, some people are afraid to get involved by themselves. As a former EMT, if I stopped at an accident and I had my green light on, if I turn the green light on, guaranteed I'm stopping, because that person might need help. Depends if I'm with my family, I may not always stop. But if you see somebody else there, you're almost always gonna help and assist. So don't be afraid.
Right.
You don't do anything, the person is gone.
Right.
And don't be afraid to hurt the person, because on the same token, they're almost dead. You're trying to save them.
Exactly.
The main thing is
Right.
to
Yeah.
start
If you
circulation.
stop to help, you can't be so
Good
just
Samaritan
good
laws.
Samaritan law.
Yeah. Of course, don't be reckless, but if you're making a good attempt, following the sheet and doing everything that it says, then, you can't be sued if anything goes wrong generally.
And if you want to take the class, call up the ambulance number, leave your name and phone number. Also, the county is giving free CPR classes on weekends. Call the county emergency service number. Check their website.
And we will leave this here. If anybody wants to come up, by all means, come up and do some compression, see how it feels. And I'm going to tell you that
Yeah.
that it's actually, believe it or not, easier on a person than it is on this mannequin. So if you could do this, you could easily do a person. So, okay.
On the Heimlich, what you do is on an adult.
So it's right
Do
at the
you
end.
want to do it on
Right at the
a...
end.
Just think about what you want to do. If you want to practice on somebody, always make sure they open their mouth, because if you're doing the Heimlich, you could actually burst their eardrums. So you want to do is put your thigh against their butt, put your, make a fist, put it against their belly button, and squeeze in. You only squeeze in 4 to 6 times. And you practice on somebody, make sure their mouth is open, because you're creating such force. We've seen people when they do it, if they have a piece of meat stuck in their mouth, they could fly out 20 feet. You're creating that much force. So if you practice on somebody, make sure that, people laugh at that, but it's really a serious thing. For an infant, the Red Cross and Heimlich finally agreed that they want you to do back blows and stomach thrusts. The stomach thrust is the same thing as the chest thrust, but for the Heimlich, it's called a chest thrust instead. It's done in the same spot, and you do 4 to 6 times. do the infant, and the biggest thing is, again, this is a lot bigger. What you want to do is you always make sure before you do it, move away from the table, because too many times somebody goes, and if it's your kid, you don't want to kill the kid. And people laugh, and it's your adrenaline's flowing, you're panicking. One thing I always taught when I taught CPR, please move away. 1, 2, 3, 4, turn the kid over. 1, 2, 3, 4. Look, see if anything come out, and keep doing it. And you keep doing it until something comes out.
Okay. On your lap, I was reading somewhere that you should put them on, like, over your knees.
You could do that, but then trying to move them up and down sometimes that's hard. It depends. If you're comfortable sitting down, if you're tall like me, it's probably easy to stand up. It depends how long your arms are. A lot of factors go into it.
How big the baby is.
Exactly how big the baby is. If the baby's too big, it's no longer considered an infant. Now it's considered a child.
Okay, let's get back to the pet first aid. If we could.
Okay.
And just FYI, we're very informal here. We have snacks and water right over there. Help yourself to that.
And we're always looking for new members.
I also just wanted to say, thank you for that. I also just wanted to say, it made me realize when you have different size animals, the heart is placed a little bit different. So if you have a small dog or a cat, you're gonna try and go, so, right, if you go to like the end of the rib and then up, like right in here, small animals, their hearts are gonna be a little bit more closer to their back. Large dogs, especially ones that have like a Doberman or a Greyhound, a German Shepherd, their hearts are gonna be down here. So it kind of changes the position. Usually we'll, if you have a step stool, like if they're on the floor, sometimes it's easier for us to have them on the table, we're on a step stool, and then we're doing our compressions. On the floor, for me anyway, it's a little bit harder. You want to make sure your body's over the animal, but if you put your hand for a small dog, you're gonna go in the center. Deep-chested dogs are gonna be more down here. And then like Lauren said, your bulldogs, they're on their back and you're going right on, yeah, thank you, right on the sternum. That's the word I was looking for before. So I gave another handout, I guess there are none left, for first aid. One of the ones, I think I'm gonna use this guy here. One of the first things is the choking with the ball. This is something that it's really, really hard to grab a ball when it's in the back. I mean, I can't even tell you how many times we've tried, and it's scary because they're choking. It literally occludes their airway. So what you want to do is you want to quickly flip them onto their back. Flip them on their back. Their neck is extended. It's easier, especially like in the larger dogs, to be literally right on top of them. And the movement is, you're gonna use your thumbs. Your thumbs are gonna go, you wanna make sure that you're not touching the trachea. You're gonna be on either side of the trachea. So it's kind of right in here. And you can usually feel where it's stuck. You're gonna put your thumbs behind the object, and you're gonna do a movement that goes down and up towards the mouth. You can use your fingers to kind of, if you need to hold on to the lower part of the jaw, if you need to like hold on to something just to give you a little bit of traction. Thumb behind the object, down, up, and literally that ball pops out. So that's something that you can do. Like I have my first night in ER, and I had someone on the phone, and unfortunately they were driving to us and the dog didn't make it, and I have nightmares about that to this day. This was almost 20 years ago. So it's a great thing, you know, to just know. There are actually videos, there are YouTube videos on people doing this, so you can, you know, you can definitely do that as well. You can, you know, just Google it and see if you can find it. Does somebody want to tell me what I have next on? And does anybody have questions? Yeah.
Is there a name for that type of?
Maybe it's like I wrote it on there. It's like the external extraction technique.
And then so that's Google external extraction technique.
You could probably just Google vet popping ball out.
Yeah.
Dog
Yeah.
choking on the wall.
Yeah.
And
Yes.
they show a video of someone actually getting the,
It works.
and it pops, literally, it pops right out.
Here I have a little rat terrier, so she's smaller, and she grabbed like a hamburger, and she was choking on this hamburger, and we just Googled, and it didn't tell us to the highlight, but it did pop too, like it popped the flew out of her mouth.
Yeah, yeah.
So, but with a hamburger, because it's softer and it doesn't have.
I don't think it would work. I mean, if you feel something there, you can move it up and then use your hands. Be careful, don't get bit. You know, but you can scoop in dogs. We used to that a lot.
This
But-
technique is more for like a hard object.
It's like a ball, because it's harder to grab out, because like your hands can't
It's just
press
too slippery,
onto
right?
it. Yeah, it's slippery and it's farther down their throat. It's usually, I feel like it happens a lot in like, again, those bigger, large breeds like Shepherds, Dobermans, things like that, because they have the longer snout, and then it goes back into their throat, and you just can't reach it at that point.
So with any breed, you would put them on their back to do that?
Yeah, everybody has to be on their back so that you literally are visualizing and you can kind of see that bulge. You can feel it with your fingers. Your thumb goes behind, down, up.
So you're saying to straddle the dog?
Yeah.
Straddle the dog.
What would you do though? And I've had this happen, I can't eat sometimes, and I have small dogs, runs a Pomeranian, and she just, when I wanted to check the inside of her mouth, I could not get her mouth open. And if they clam down a lot, it worked. And I tried this, you know, tried to get those sides of the mouth, put pressure on to open up the mouth, and it works with my other.
Was she choking, or did she have something in her mouth that shouldn't
Well, I
have been
wasn't
there?
sure, it seemed like it,
yeah.
and I never found out, luckily it wasn't a dire emergency, but I wanted to put my finger into, try to see if there was something in there, but I didn't get my finger in.
If they're fighting enough, she's probably breathing.
Yeah.
You know, she probably isn't choking, and you may have, you know, either time to get to the vet, or sometimes what happens is they're just freaking out because they can't breathe, and that's another situation. And I hate to say it, but I've had dogs where, you know, they're not needing to bite, but if they're trying to bite, we can't sedate them. You know, we're getting everything in order to sedate them to help them, but sometimes they'll pass out, and then we just really quick get it out, and then, you know, we just give them oxygen. But so there have been those situations, but it sounds like in that situation with your dog, maybe she just wasn't choking. But yeah, you do need to be careful not to get bit. It's inadvertently, it happens.
So if they're, let's say, choking long enough and you're able to get the ball, is it recommended for them to go to the vet after, or if they're okay, you gotta wait?
I would just to make sure that everything is okay.
Not to do with choking, but I know I read somewhere that you take animals on ice or something. Somebody recommended keeping like a septic in your first aid kit. If the animals get, if the forehead's got cut or something, do you recommend that?
Oh, yeah.
Okay.
I'm sorry, can you repeat it? Definitely.
I read in one of the comment things that somebody was, it's called company that loves dogs, and they put together like a first aid kit, and they said keeping a septic, like a step, yeah, like what men use when they cut their faces. Use, it's powder. Yeah.
They make powders and they make sticks
Powder.
too.
Use that in your first aid kit, and this way, I can when you go, even at home, and they rip the hair off, they cut themselves, you can't stop the bleeding. So some of the septic has the powder on it, and that'll help the blood.
Yeah, that I've heard that.
Okay.
That's what you meant this week.
That's what I meant.
up their back end. So you have gravity helping you. It's not as effective, but it can work. If they're passed out and it's something soft, just put them on their side. You can do the same thing. You can, use the elbow as a guide, you can use the sternum as a guide, and even side compressions doing the Heimlich maneuver. I did have this with my neighbor, and he called me, and I literally ran over, and like you said, I mean, that food shot across the room, and this is a Rottweiler, like, passed out on the side. I thought he was dying. So those are pretty much your options, and then somebody tell me what I had. Oh, bee stings. Okay. So with these things, I mean,
like
basically
bee
it's self-explanatory.
I think you have to take them.
If you weren't able to get a copy, maybe you can borrow one, take a picture of it. It has doses for Benadryl on there. So if you have a dog that is over 10, 15 pounds and you have the tablets at home, the dose is 1 milligram per pound. So a 25-pound dog is going to get the 25 milligram Benadryl. If you have a small dog, you can use children's Benadryl, and I have the dose on there for that as well. You can give it every 8 hours, but I do also recommend, if this is happening and obviously if there's facial swelling, you want to make sure that there's no anaphylaxis. Get them, give the Benadryl, go to the vet. If you don't have Benadryl, don't stop at the store, get to the vet.
Also make sure it's plain Benadryl, there's nothing added to it. And if it's the children's one, make sure there's no fake sugar, xylitol, or anything in it.
So could you get the liquid one or just the pill?
Yeah, just make sure there's no added sugars or like fake sugars like xylitol.
Like dyes.
80 pounds or what does you give that?
So I would probably do 25 milligram tablets, 3 of them.
Okay.
Because it's like 1 milligram for every pound.
Gotcha, okay.
Yeah, so for something like that, I probably would do 3.
Just got a question.
Oh, yeah. Cats are easier because, I mean, you can do, how you hold children, how they say, hold infants. Very few. Yeah. So you can also with cats, again, using gravity, you can pat their back. You have one hand on the sternum, you can pat their back, turn them over, check their mouth. So with cats, it's pretty much the same thing. Like I guess it's easier to hold them in your hand. And if you have a big cat, let's say you have like a 16 to 20 pounds cat, do what I just did. Yeah. I think I had on there how to make them throw up. Thank you. So inducing vomiting. So if you're the one main thing with that I want to just make clear is if you're not sure if you should make your dog, and I'm saying dog specifically because I don't recommend doing this in cats. So do not give your cat hydrogen peroxide. But if you're not sure, please call. There are 24-hour hospitals that you can call. They will get on the phone with you and let you know if this is something that you need to do at home, or if you need to get them in. But you want to use hydrogen peroxide, 3%, not the more concentrated one that we use to color our hairs. So it's just the 3% hydrogen peroxide. For a small dog, it's a teaspoon, so 5 mL. If you don't have syringes at home, anything, a turkey baster, anything that, a pipette, anything that you can suction something in, you don't have to get them to swallow it. You don't have to go straight to the back of the throat. Get it into the cheek pocket, and then if they start licking and swallowing, that's fine too. Medium-sized dog, you're going to do a tablespoon. Larger dogs, and we're talking about our big, our shepherds again, Rottweilers, you could do up to 3 tablespoons. You may not even need that much. Start with 1. You can add another. But then the max dose, and I don't remember if I wrote this on here, but the max that you want to do is 45 mils. So 3 tablespoons is your max. If they don't throw Not really, but when you give them the hydrogen peroxide, I don't know if everybody can see, but we jiggle. We just kind of shake them up a little bit, you know, and they throw up.
And they don't always throw up from hydrogen peroxide, so keep that in mind too. If your pet doesn't vomit from that, then if you're in contact with a vet, you're probably going to have to go and they'll make your pet throw up because it's not always successful.
Yep. So we have drugs that we give IV that makes them throw up literally within seconds. Any questions about that? Okay. What else? Does anybody have any other first aid questions?
About charcoal, isn't charcoal sometimes given to dogs when they're something like addiction?
So activated charcoal, yeah, so activated charcoal, there's two different types, and it depends on what it is that they use, and that will bind. So sometimes we use activated charcoal when we're not making them throw up, or if too much time has passed, and like if somebody calls and said, my dog just ate, you know,
Medication usually.
yeah, like medication or Baker's chocolate or something like that. But I mean, if you call and say, it's been about 2-3 hours, I don't know how, you know, a lot of it is already absorbed.
So that's used for if something just happened? Because I
So-
know it's in a lot of the pet first aid kits.
Yeah, you use it usually in cases where you can't get the item out of the stomach or it's not recommended for them to vomit up that item. So a lot of medications have a quick absorption rate. So like vitamin D is something that we see pets eat often, and you can give them activated charcoal after. But again, like in that situation, you would go to your vet for that because they can overdose on that medication and they're going to need additional support as well. So usually as a pet owner, you're not going to give activated charcoal on your own. It would be something that your veterinarian would administer for you. Yeah.
I just wanted to point out that there is a poison control for pets.
Yes.
That are small and they can also
Yeah.
recommend to you, because if the vet isn't open, you're gonna be right now trying to find an emergency vet. So all poison control for pets, they will help you figure out what you have to do in the meantime until you find an emergency vet.
Yeah. A lot of times we'll recommend that anyway. Even if you call a vet, we'll recommend that you call poison control because they can dictate the treatment plan for us.
And I did have a situation where someone called poison control, they were on hold for like 30 minutes. So there are, you know, if you Google poison control, there's a couple of different,
There's
numbers that you
ASPCA
can
and Pet
try.
Poison Helpline. Both of those are really good.
Yeah. I put on their heat stroke because, I mean, next week is supposed to be really hot and we're going into the hot summer months. So the main thing with that is just knowing which, you know, what the predisposing issues might be. So brachycephalic dogs often have the short noses, small tracheas, your bulldogs, your Frenchies, pugs. Be really, really careful. I'm sure everybody here knows that. The signs to look for in the early stages, they just start, they have noisy breathing, their gums might get really, really red, they're panting heavy, they're hot to the touch. Late stages, collapse, seizures. So I think the most important thing to not do is to put ice packs on them. I think that's everybody's first impulse is to get ice or ice packs, but what that does is it actually vasoconstricts the vessels in their skin. So cool water is okay, washcloths. The most important thing in that situation is doing that while you're transporting to the vet, because heat stroke, you know, once they're in late stages of heat stroke, there are so many things that can, you know, that are life-threatening. Make sure you're not leaving the dog in a car, even though, you know, outside the temperature, you know, might be just in the 80s. It very, very quickly heats up in a car. And just be careful with walks with your brachycephalic dogs or dogs that have respiratory conditions, cardiac conditions. So I think that's kind of straightforward. Okay. Does anybody else have anything else that you would like us to cover?
I have a quick question.
Yeah.
Just because I know we have two very venomous snakes in this area, what's the protocol? What vet, I know most vets don't carry antivenom, where would you recommend?
Good question. Lauren might be able to answer that. Lauren does
So,
emergency medicine.
You
so.
can go to, most emergency vets will have the antivenin, but right away. If your pet gets bit, you want to go right to a vet, because the faster you get that into them, the faster and better rate of recovery. So sometimes it's really hard to notice if they got bit by a snake, unless you physically see it happen. If you look for those 2 puncture wounds, or you notice severe swelling in their limbs, or usually it'll be like around their front or back legs or around their neck, bring them to a vet immediately. I know usually Ordell, Veterinary Emergency Group, I don't know about Blue Pearl and Paramus, but most of them all have antivenin. So call and ask first, but usually they have it in stock. Flannery, their hours have been changing.
Yeah,
too,
they
so I
usually don't have it. I've called, and sometimes human hospitals will have it, but usually I've had one situation where we had to get it from a human hospital. But
We can't even resort people hospital, unfortunately.
Yeah.
yeah, exactly.
Right.
That's,
You know, you recommend if it's on a leg or a fork, to put a constricting bandage over it?
No, it's not. Yeah.
At all?
It's not going to make a difference at that point. The biggest thing is getting the antivenin in as soon as possible, and that's going to help increase the chances of not losing the limb and things like that.
One thing I just want to get to that, a lot of people think, well, they slice the snake and the snake's laying in a bed, so they put the snake in a bed and take it, because of course the doctors don't want to see the snake to identify it, see if it's poison. Do not do that, just take a picture, because I don't know if you realize this, but a snake can still bite and inject venom into your several days. Several days. Just the head. Several days. Let it go.
It's like create a whole different thing to make sure that it works. And then sure, they got the impact. So that's great. So they got a whole different thing that does it automatically.
Wow. That's so crazy.
I mean, unless anybody else has any, in case a dog has a seizure, how would you help restrict anything that they do? Think there's anything that you can actually administer at home if they're having a seizure. I think it really would just be getting them in while they're having a seizure. So some seizures are just going to be partial seizures or like full chronic seizures where their whole body is going. Don't do the move their tongue. Don't stick your finger in their mouth. Just make sure that they're in a safe place. Just leave them, because typically seizures are not going to last a long time. And you can wait till the seizure is over and either get them to the nearest emergency hospital, or at the same time get them to the regular vet. I can you think of anything?
Unless it's not a first-time seizure, like sometimes I know at emergency hospitals we'll send home with a rescue dose of midazolam, and that can be given intranasally or rectally. But if you don't have that on hand, then it's not going to be something that you give. If it's a first-time seizure, you're just going to go right to your vet, or call either or while they're having the seizure. You can call a vet and just get advice that way. But there isn't many medications that you would administer.
Okay, so that's what he was talking about before. So bandage, pressure. So pretty much we just take, we can take gauze, cover the wounds, vet wrap. I think that was one of the things that that's in here. I mean, it's obviously it's small. You can buy like larger
for like heavily bleeding and things like that, again, you're going to want to bring to your vet, but if you're trying to treat it and you have a long distance to go, you don't want to tourniquet for a long time because that can cause further issues. So just a pressure bandage, like the best that you can do while you're in that transport stage.
There's also an lightweight over the shoulder carrier for dogs, so we're not still put it on Amazon.
What is it?
It's like a over the shoulder harness carrier, but like it's like a sling with leg holds for dogs too. And then you got to carry the dog out.
And what size?
Yeah. I forget what it is. I have a set with that.
I have one question, it's kind of off the wall. With the rise of opioid overdoses that we're seeing, if your pet ends up getting into somebody's stash, and people have a usual knocking, can you give it to the dog and if so, what dosage?
So naloxone has a very, very wide range. I think you can go up to 0.02 mg per kg. I don't know, but yes, I mean, you can definitely use it. I haven't looked at the dosing to see how it matches up for like what size dog.
I've seen like one squirt intranasally
Yeah, I
with the
figured
one that,
something like with a child or something with the same type of dosage per weight.
yeah.
I know for an adult, you only give, if it's a 3 mg thing,
How many milligrams is it?
I'd have to
Is
look at
Narcan?
that.
Yeah. So with dogs, you definitely, and cats too.
Different size.
Yep, it's based on size. You can go up to, like I said, I think it's like 0.02, and I've also seen like up to 0.4 mg per kg. But again, I don't know how it translates to how many milligrams in Narcan.
Hopefully, it
Yes,
happens to anybody, if they happen to have it.
it happens.
I'm sure.
Yeah.
It happens.
A big one now, we'll see THC toxicity
Right.
all the time. So that's very, very
It's
common.
not freaking out the pocket.
Yeah.
So what can you use? I'm sorry, if they ingest it?
I know people have taken either Narcan classes that they give away free Narcan. If you happen to have it, you can probably just call the vet and say, hey, look, this is what happened. How much should I give my dog?
If they ingest it?
If they ingest it.
If you know that they ingested an
Exactly.
opioid.
If somebody in the family has, or somebody outside did
So
it.
what do they suggest that you use?
Well, again, if somebody happens to have nasal Narcan, and then the county animal store sponsored it a while ago, and they get like accuracy in they Narcan, and somebody was happen to have that, and had it with them, and the dog was pulled out of on before she had it, they could call it out of those.
Because my question was if they get a hold of like a dose, like a pill, the Narcan is also, same thing, it's like a painkiller, right?
Yeah, but Narcan, normally, nasal Narcan is that it's liquid, you
Oh,
inject
it's
it
a
in the
pain,
nose.
it's something else. So if they wind up getting a hold of a painkiller, what?
Yeah.
The vet is not open, what do you do?
Call an emergency vet. So I would recommend looking up what emergency vet that's open 24/7 is closest to you, and put that on your fridge or something.
Where do you live? Know what to do
Where are you located?
in this area, in Woodbury.
So your closest would probably be Veterinary Emergency Group in Nanuet. Or Guardian in Middletown. Oh, I'm sorry.
The question,
know
her
if he's around.
question was if your pet ate a pill, what would you do? Like a pain pill or something, but we were just asking her, she didn't know if there was, where the nearest emergency hospital was to her, so. But something like that, the other question was about getting into opioids. Like if you know your pet got into opioids, the question was, can you give Narcan? Did you hear that? No, okay, sorry, all right, so, can you hear me okay? Okay, so, I don't know how the dose translates, into what dose of Narcan it is, and then what size dog you can actually give, but Lauren said that she has seen where they'll give like, what was it, like
One
just
squirt, like
one
the
squirt.
one that's like an intranasal squirt.
Yeah, the intranasal Narcan, so you'll do like a squirt into the nose, get them them to the emergency hospital, and we were talking about where the nearest 24-hour hospitals are. So there's veterinary emergency group in Nanuet, Flannery Animal Hospital is in New Windsor. I'm just not sure about what hours they're open 24/7 now.
Guardian in Middletown on 211.
Guardian, Wardell in New Jersey, Pearl is kind of right across the street. So, I mean, all of them are probably going to be anywhere from like 25 to, yeah, maybe 40 minutes away. But at least you can call and maybe even talk to someone to get some guidance while you're on your way.
Would inducing vomiting, if they got into medication, be like the first line of defense?
Yeah, yeah, absolutely. So the question was if your pet or your dog got into pills, is the first line to make them vomit at home? Yeah.
I know one time I went to take a blood pressure medication. I accidentally dropped it. Before I could pick it up, my dog got it. So the first thing I did is call my vet. Luckily they were open. I told them what they took, what dosage it was, and what my pet's weight was. They told me the dosage I had was so minor that I didn't have to do anything. I was freaking out. I thought I was
That's why that happens a lot.
Yeah.
Yep.
Yeah. You can also call poison control for that too. If like your vet isn't open,
Right.
and they'll give you that information. They can say you don't have to do anything, or we recommend going to a vet.
I know with Flannery, not a part of PCA, on the email we get, they tell us it's an emergency vet number to call, questions like that.
Yeah.
So post there, if they're not in the open time.
Right.
They post it on Facebook now.
Right,
Mm-hmm.
exactly.
Okay. Any other questions at this point? Any other questions? Okay, and maybe we'll be here later if you have any other ones. So just in concluding, I just want to, of course, thank our mayor for hosting. And, of course, the Pets I Love, fabulous vet. They're in Monroe. They're really a pleasure to deal with. So if you need a vet, I would highly recommend them. And now we will move on to the final part of the presentation, which is the Woodbury Police Canine Officers. Do you want to say anything up here beforehand, or? Okay, so they have very loud voices. They don't need the microphone.
Everybody, just so you know,
Move
this
outside.
has been recorded for today.
Oh, yes,
So
yes.
if you wish to have a friend view it or review it yourself, it'll be available Monday on the YouTube channel.
Yes,
Okay?
on the YouTube, also on Woodbury Ambulance Facebook page.